right, and we are back. Thank you so much, Raucus. And yes, it is October, so we are celebrating Breast Cancer Awareness Month, and we do that. You know, here at TTT, we try to cover all these issues that may surround us, and it's why every Thursday we have a segment, Your Body and You. And today we're going to be speaking with Dr. Safeeya Mohammed to talk about preventative care. What are some of the things we can do to ensure that we know the status of our bodies, that we can understand our bodies so that we can know what signs, what symptoms to look out for, and most importantly, that early screening. Good morning to you, Dr. Mohammed.
Good morning, Natalie. Thank you so much for having me here on TTT.
You're so pretty.
And thank you so much for all of the organizations, NGOs, and especially Roche that has brought this particular segment to being.
Yes, definitely. And I think it's one of those important segments, you know. The first 2 weeks we spoke to 2 survivors.
Yes,
and it
Sarita,
was just, yes.
darling, close friend of mine as well.
I know, right? Listen, she wears that badge so well. Like,
She's
I'm so proud of her.
Epitome of resilience.
That's correct. I think that's what really stood out with her.
Yes.
But Doc, you're here to talk to us because you yourself had, you were a caregiver for somebody who was diagnosed with cancer. And I know, I just want to speak to you a little bit about that because sometimes people don't understand what it means to be supporting somebody who is ill. So talk to us about that journey. When your relative got diagnosed with breast cancer, what kind of impact it had on you?
Well, first up, Natalie, this particular person is the closest thing to my being. This is my maternal aunt, but my mother in every single way. And then, of course, knowing the background, knowing all of the aspects, sometimes too much knowledge can be to your detriment. Knowing the genetic inheritance risk as well. She lived a healthy lifestyle, not necessarily any risks that we typically advise persons on to be aware of. And to all the viewing audience, you know, good morning, I actually didn't say good morning to the viewing audience. That is probably the most important message coming out of this, is that sometimes you can have no risk factors at all, and that's why screening is so important. So she had none of the typically identified risk factors, and she just had this abnormal symmetry, and she thankfully—
And you're talking about
the breast anatomy, the symmetry.
So they weren't in line with each other.
Exactly.
So that could just be
certainly.
a sign?
That is a huge sign. The abnormal, so this is a part of, I would say, Roche preventative screening program, and all preventive screening program is knowing your signs and symptoms. One of the biggest ones is being familiar with just the general anatomy of the breast, knowing the skin complexions, knowing the way it can be perched in the nipples, knowing how if there's any discolorations, and very importantly, asymmetry, so the symmetrical appearance. So she had—
I never ever thought that could affect somebody that just—
But
is it that you're talking about the symmetry? If your breast is always like that, because I'm always under the impression that your breasts are asymmetrical.
In that there was a dimpling of the skin. So with the skin and that particular breast that had the cancer, there was asymmetry and dimpling on the skin. So that is probably one of the other, we have that particular infographic we can pull up at some point in time. Right, fantastic. So those are some of the nipple discharge, the dimpling of the skin, and even you can have pain or not, but you can also not have any pain, and that is important to note. So she just had asymmetry and this kind of gut feeling that something was not right.
Which sounds like what Sarita shared with us, because Sarita told us that all she had was some discomfort in her armpit.
Yes.
So, and it goes to show you that the breasts, I think one of the things we have to understand is just how far back does the breasts go?
Right.
Because that's something I don't think we've ever really discussed, because we think it's just, you know, just this hand cup and that's it.
Exactly. And I think what we also need to know is that the cells of the cancer, they're so microscopic. When they start off in stage 1 as within the breast tissue, then they can move across into the lymph nodes, which are under your armpits. So an important part of that self-breast examination is also examining, feeling under the armpits, feeling under the other aspect where we have lymph nodes, the posterior and anterior part of your neck, and knowing your breast, most importantly.
So you're telling me that even with breast cancer, is that if your lymph nodes along here are activated, that could be a symptom that you should definitely check?
Certainly a symptom, because that's where the cells have now moved into spread, moved outside of stage 1 and stage 2, and moving into outside of the tissue. So all of these are important. It's not just a lump within the breast, it can also be a lymph node. Now, it's not first and foremost. The message is that there's a lot of fear in diagnosis. Knowing these signs and symptoms is your friend. The more knowledge you have, knowing is important, but the action of it is next. And I think
that's where people run.
And I think my aunt, as I shared to you, this is like my mother in every way. She had that close bond with me that it was probably a conversation at 1 o'clock in the night, and she's like, "Baby girl, I'm not feeling well." And then it's that gut feeling. And she talked about it, and we actually started doing the initial screening, and nothing showed up. So
you did a screening with her did a breast exam with her, being a doctor.
Yes, and that's also important to know that it's not just one aspect of screening. It's your self-breast examination, your physical examination with your doctor, mammography, and also breast ultrasound, because you want to be able to really pinpoint. When it's small, it may or may not show up initially. So it's not to be overly in fear, but also to just be aware. Let the fear fuel your awareness. And thankfully, that gut feeling that she had, and I being, I guess, having that knowledge and background information, I didn't let it sit. So we continued. We did all of the examinations. She did indeed need to do surgery. She did indeed need to go further into chemotherapy, radiotherapy. I went with her to every single chemotherapy treatment.
And here you are now practicing preventative care for breast cancer.
It fueled my own journey. I used to work in the ICU, intensive care unit, in a neonatal intensive care unit, in fact. And having seen so much beginning of life and end of life, I realized that let me switch paradigms more into preventative. So it's not only breast cancer, lifestyle diseases on the whole, right? And it's so important. 88% of all diseases that we encounter are in fact preventable.
Yes.
With breast cancer, if we pick this up in stage 1,
we're good to go.
Yeah,
because
you're curable.
Things and times have changed, where treatment options have also changed, and that one of the things I learned from Dr. Oliver, who was here last week, is that you're not even at the point where you have to remove the entire breast anymore.
Absolutely. Absolutely.
So we talk about screening, how important that is, and even the steps of breast, the self-examination.
Yes.
And one of the things Dr. Oliver shared with me last week is that most of the times it's the patients who pick up something just from doing that exam.
And that is invaluable. Your knowledge of your body, yourself, can save your life. And that's why the focus here today is not just empowering moment, but educating you with the right information to save your life, to save my life even. Who knows? I just met in the studio someone that knew me from before, and she gave me an invaluable tip there. So the world is wrong. The information always comes back. And with screening, you can have absolutely no symptoms, not even a family inheritance, a genetic inheritance. Now, that's an important fact to note. The fact that my maternal aunt had breast cancer mean I already have a high risk. So I must do my screens regardless.
How often do you get screened if you have that genetic disposition?
Excellent question. In the ages and the recommendations have been changing and evolving. Previously, it was over 45. Now we're seeing persons who are younger, in the ages of 40, presenting with breast cancer. We're even seeing in the 30s. So it would really be dependent on your risk factors. I would say start with a preventative healthcare screen with your healthcare professional from about age 35, right? let that guide the risk analysis. But definitely, once you hit 40, you want to do a full screen, your mammogram, your breast ultrasound, and definitely be guided by your healthcare professional.
Right. So I am at that age and I'm 41. So I'm
Well,
at the
yeah,
age where I
we
need
need
to
to.
be getting that screening. So you speak of the mammogram. We have the self-examination and of course the ultrasound. And you're recommending that they be done in tandem, not one.
Exactly.
Not one for the other, but all of them, because you're saying we could do the self-exam and not feel or see anything.
Yes, but it's important to know that you know your body, and in knowing your body, you will then identify if there's a change in your nipple appearance, there's a change in the breast appearance, and again, the change in the symmetry. During the course of last week, I also had the opportunity to have a discussion with Professor Vijay Narayan Singh, and he's well known in terms of the amount of surgeries he's done, and he shared that breast cancer is still the #1 cause of death in females in Trinidad and Tobago. And
that something?
Breaks my heart.
And this
especially
is
knowing
that
it's preventable. Yeah. That breaks my heart.
Not heart disease.
No, not heart disease.
Not diabetes.
But
breast cancer.
Breast cancer. And a big part of it is the fear in seeking diagnosis.
So why? Why? Understanding that this is the #1 thing that's killing us as women, why do you think we're so fearful to go and get screened?
Because it's the acknowledgement I have cancer. It's still a hard thing. I'm a healthcare professional and I'm right there with patients. It is the acknowledgement of the journey. But that journey has changed. Medical advancement, innovations has made that journey easier, much more better equipped. Curable. It is actually curable. However, the statistics is still so alarming. Now, we're talking about some of the screening methods. I want to highlight certain things persons may not necessarily know. We've had a lot of patients when they come to do mammograms and they may not recognize how to prepare for a mammogram.
All right, yes.
Did you know that you're not supposed to wear on deodorant or any perfumes or even body powder?
Had no idea whatsoever, doc.
Yeah.
No idea.
Right? And let me tell you why we advise to absolutely, and not just us, any sort of institution. Pink Hibiscus also did an entire discussion with us, and their mammographer shared that a lot of women come in, obviously, because every day that's part of our daily habits, wearing a little bit of body powder, wearing deodorant. However, within that body powder or deodorant may have little micro calcium deposits, and it may give false negatives. Exactly. So when you're going to do your mammogram, it's important, be educated, be aware of what you're going to do, your test itself, no perfumes, no body powder, no deodorant whatsoever on the day.
And what about the ultrasound? The same?
Same as well. Not so, the body powder wouldn't affect the ultrasound, but it's certainly, if that day you're going to do all of the examinations, then prepare mentally for it.
All right, Doc, here's something that we can share with patients so that maybe it will encourage all of us to go and get screened. What is the life expectancy for somebody who's been diagnosed with breast cancer but got screening early?
Stage 1, 100%. Stage 1, we can remove that lump. You can maintain your normal anatomy. You can have, the breast cancer is considered curable if it is. So let me not say 100%. It is in the high 90s, but it is curable. You can live cancer-free life.
When do we get in danger?
In
From stage 1 to 4, when do we get to the point where we realize that we are definitely in the red zone?
Right. So there are different stages. The minute it starts to go outside, we start it in zones. So one particular organ or one particular tissue area, the breast. Then we move outside, which is the lymph nodes. And then we move to the major organs, as in the liver, the kidney, the lungs, the bone. Once it starts to spread outside of the localized area, then that's when we become high. So stage 4, stage 3, dependent, right? But all of those stages, you can still have chemotherapy, radiotherapy. In fact, Sarita's was stage 3, as far as I remember. So, and she's living her best life, you know? So, prognosis is becoming much better because we're identifying earlier, because we have a range of options.
Yeah. Look, I can't even tell you we are out of time. I don't even know where
One
the
last
time
point,
went. Yes,
that
please.
men can also get breast cancer.
We spoke about that. I have a cousin who is 35 years old now, or 36, and he found a huge lump in his left breast, had it removed,
So
and now he's on these drugs for the next 10 years.
Exactly. So men can also get breast cancer.
Yeah.
They have a higher mortality. It's 1 in 2,500 according to American Cancer Society. So I know we're out of time. My last point is to just encourage all women. Educate yourself, empower yourself. Knowing is not enough. Move it to action.